Yes, good morning, everybody. I'm speaking from Ghana. I'm actually based in Ghana now, but I'm a research fellow for the University Medical Center in Utrecht, so I do visit from time to time. And I'm very happy to be part of this and looking forward to a very exciting presentation and discussion. And I hope that at the end of the day, we would all be happy with what we discussed together. And I want to thank Prof. Osborne. I think he has laid the foundation for this presentation that is usually difficult in many times because of the concept of planetary health that a lot of people don't really grasp with. So I'm trying to move my slide. Yeah. So today I'll be trying to do a presentation on planetary health through health system lens, and how communities can harness their voices, knowledge systems, and social networks to promote climate responsive health systems. So I would like to look at it from a health systems lens because of we usually underestimate the power of the health systems and the experience of the health systems with communities and the level of trust that communities do have in our health systems. So I would like to start with this very complex infographic that I picked from LinkedIn, that is sustainability infographics. And as you can see, they describe climate change as a wicked problem interconnected with other global challenges. So what it simply means is that we already have challenges across the globe. People living in communities have challenges. And what climate change will do is going to make these challenges more worse. In effect, it's going to worsen our condition as communities. And you can look at this complex diagram and then you ask yourself a question. Who does this impact more? I think everybody fairly knows that it's communities. It impacts people, and communities are at the forefront of these. And again, all these pathways that we see here affects the way we live in one way or the other, and that has the potential to impact our health directly or indirectly, making health a central part of the discussion on climate change, and also making the community a non-negotiable part of the discussion on climate change. So now I would zoom straight forward to health systems, try to find out the pathways between climate change and then health systems. As most of you would have already known, because of climate change, we are beginning and will continue to witness extreme weather events coupled with so many other things. And then again, we are going to see possibly things that we have not seen before in diseases because pathogens work at certain temperatures possibly. And once there's climate change, the environment changes and we might see a rise in new diseases, or we might see diseases emerging up in places that they never were before, or we might see us as a world going back to diseases that we had already made progress. We see them suddenly resurfacing again. So you see that the red pathway obviously takes us to this gamut of problems because of the extreme exposures to extreme climate weathers. You see a very big gamut of problems in red, but you also see green to my left, and that is vulnerability factors. What it tells you is that we would always have extreme weather events resulting from climate change, but the way this impacts us depends on our vulnerability factors, geographical factors, sociopolitical factors, socioeconomic factors, biological factors, and our health status. So it is very important for us to know that the communities are still at the center of this, whether it is health or it's any other thing. And then we need to look at this very critically. And then to my right, you would also realize that the health systems, which is supposed to promote our health itself, is threatened by climate change. So why health is very cardinal to this, it's that it has the responsibility as a first responder. It has to help us navigate our health, and then itself gets impacted by climate change, making health and community, like I said earlier on, a very important player in the discussion on climate change. Now, I want to give you examples that I'm sure many people who have witnessed this, whether you are living in Europe or in Latin America or in Africa. To my extreme left, obviously behind, you see um, a lady in a t-shirt, obviously delivering a health intervention. But behind the lady, you see a pool of water. There is flooding. So what it simply tells you is that once this health worker gets out of this place safely, there is no way the health worker is going to come back. And we all know that most of these health interventions that we give to children and other people generally are kind of time bound. So what happens to the community there? Now, to the middle picture, you can see that a whole health facility, I took this from the WHO Afro website, has been ripped up by storms. And interestingly, I can see a lady. I've always never noticed this until sometime last year. You can see a lady standing beside the health facility, and then she's making a call. You really can tell that this is a community member that is really impacted by this, and you can imagine what she is lamenting at this time. Then to my extreme right, you would also see that, well, there's a bushfire, there is an electricity pole that is being bent, so you can be sure that all the health facilities that are in that direction are not going to get power if they are only hooked to the national grid. And that what that means is that we are not going to keep life-saving vaccines and refrigeration-dependent supplies active. So that compromises the quality of health that we do have in those communities. Now, to my left, in the winter, the last winter, I was in the Netherlands, and then there was snow, code orange, not even code red. For 1 week continuously, you can see from the picture, almost everything got frozen. One thing I am sure of is that almost everything from transport services to our daily lives came to a standstill, and that was just code orange. You can imagine when it gets to code red, what's going to happen, and what if it begins to be regular? It is more. Are we really prepared for this? In the middle, it's a whole community in Ghana, and you can see it's been flooded. Houses are flooded. What are going to be the health impacts of this, and what is going to happen? And then we can see how this happens. And of course, the picture to my right, it's self-explanatory. There's somebody who is sick, the fellow is being admitted into a health facility, and suddenly the health facility gets flooded. Now, to further demonstrate, there was a cyclone in Africa, and then suddenly, after that cyclone, 300 health facilities got destroyed in Malawi, Madagascar, and Mozambique. And as you can see, there is a vaccine carrier. And I'm saying that during this cyclone, many people will be hurt. How are they going to get the vital services that they need to survive? And then obviously in the Netherlands, quite a shocker for me when I got to see this, to realize that quarter of emergency rooms in the Netherlands are inaccessible during extreme downpours. I give these examples because I want us to appreciate the fact that when it comes to the issue of climate change, no country is immune. Whether you are developed or you are developing, you are really not immune. There can be extreme issues and the need for us to collectively work to get through this. So now, the health system itself is very complicit in this. We account for 5% of global greenhouse emissions annually. And that tells you that the health system itself has to do something about it because we consume, consume, consume. We are in the linear process of consumption. We are not doing things much more. So what it means is that you cannot talk about climate change without actually talking about the health systems. They are a very important part of this. What do we need to do? We need to reduce, we need to reuse, we need to recycle a lot more. And then you can see from the examples here, in the Netherlands, the intensive care units generate 17 kilograms of waste daily. Is this really necessary? We need to think about this as health system practitioners. And then to the middle, you can see in some parts of the world, this is how health waste is disposed. In other places, we use incinerators, but again, still we release those harmful things into the air. And to my right, these are simple things that we can do with the understanding of the community. Somebody goes to the health facility just to take medication, and each fellow is given a single-use polythene bag. Do we need this to make sure that the health systems are effective? We can change this without even affecting the quality of healthcare that we have in our communities. And this tells you a story. Two pictures from two different sides of the world. We have UMC Utrecht, and then we also do have the University of Ghana Medical Hospital in Ghana. What tells you that they are very, very huge consumption of electricity and energy. Do we need all these to be able to render efficient and quality healthcare? Could we have adapted these buildings much more better to the changing environment so that we can consume less? Then now, back to the role of the community. I wanted to give you the background and the connection between climate change and then the health systems, and back to the community. As you would have seen in the earlier slides, climate change affects people in the communities. And I have two pictures here. That is political party rallies that are very, very, very much done in Africa and possibly in Latin America. To my left, it's in Senegal. To my right is in Ghana. And then you ask yourself the question, what are these young people enthusiastic about? It's climate part of the conversation. I guess not. They are looking at roads, they are looking at hospitals, they are looking at all other things. They have forgotten the most important, climate that is affecting them every day. So we need to start bringing this onto the table. Communities need to understand this, that climate change would affect everything that they do now or in the future. So it needs to be part of the conversation. And the communities shape the agenda of politicians and what they do. So now, what do we think is the best way to approach this? I think that obviously government runs by policy. There's something I call thick mainstreaming. And then for this policy starts with agenda setting. And I think that it's very important for participation at all levels, especially at the community level, for them to involve community members. The system should put in place processes for community members to involve in the agenda setting, the policy formulation, to its adoption, and most importantly, community should be at the forefront of implementation of this policy and the evaluation. So to my right, it's a framework that we co-created with health workers. We're still working to refine it fairly, that you can see later in the presentation, that will help health systems becomes a leader in issues of planetary health or responding to climate change in communities. Now, there are three distinct pictures here. To my left, you see birds. It's the beachfront. What do birds live on the beachfront? Footmarks. What do turtles do? Footmarks, very harmful. But what do humans do? Obviously, humans, you can see it from the picture, what they do. So it begins with us as community members, our risk perception. How do we perceive the climate? Is it someone else's problem or is our problem? We need to begin to work with communities to really appreciate the risk that comes with climate change. Now, in the middle of this is a beautiful health facility 800 kilometers away from the capital in Ghana. And then, unfortunately, this was built well equipped, but it was built on a site that when it rains, absolutely nobody can access this health facility because it's muddy and it's a flood-prone area. And I asked myself this question: how was the community involved in this? They possibly went there and said that, okay, just give us land, we have a facility for us, and possibly told them that, well, you needed to do this so quick. So the facility, the community also gave them land. But which land will they give them? They will give them, obviously, the land that they don't use or they don't benefit from very much. So this is a classical example of how if we fail to involve community in everything we do or in climate change activities, this is what we get. We waste our investments and later we need to come back to reinvest. Then now you can see me a couple of years back, I went somewhere to do something in a clinic, and then before I got back there, there was a flash rain. The whole place started getting flooded. My vehicle couldn't cross, and then something crossed my mind. There is a waterlogged area in the community. Unfortunately, again, when the authorities came to build a health facility, they were sent there, and that is where they have built their health facilities. So when it rains, you probably will not get emergency services. People are not going to access the place, and health workers are not going to be able to come. So again, the question still begs, what is the level of community participation in doing all this? So you can really not do anything without the community. It will not succeed. You cannot plan without the community, you cannot implement without the community, and you cannot monitor without the community when it comes to climate change and health systems. So that is something that we need to look at moving forward. Then I want to give an example of something we did around social accountability. And social accountability, that was a couple of years ago. Social accountability, it's actively involving communities to really plan and then hold duty bearers accountable. So we used those concepts, and it was in healthcare as usual. And to my left, for over 30 years, this shed has been the center for health services in the community. So they had been using this and they had been satisfied with it, or they just thought that, well, government had even given them a favor. So what we did was that we really came to engage the community, and it was a process by at least bringing the health service authorities to really tell them their real entitlements as citizens of Ghana. After which they use something, one of the tools, the community scorecard, to really dispassionately assess whether they are enjoying the services that government is supposed to give them when it comes to healthcare. Well, they noticed that they were not enjoying the right services. Of course, the first step, it's they mobilized with a few educated people. They tried to put up a letter and they sent this out, and then they then followed on their side. They were empowered, they knew their entitlements, they knew what they could get, they began to follow. And having used this for 30 years, they started this process in 2014, and then by 2016, the government had built a new health facility on the right. So it tells you the power of community, what communities, if they are together, what they can do for themselves, and politicians and decision makers really need them. They only exploit them because communities are not empowered. They just get informed, they are not involved in processes. And then so when we get communities very active, this gives you an example of what they can do for themselves. And then this is an example in community participation, but I think that the results will not be different when it comes to issues of climate change, when it comes to issues of planetary health. I think that or when it comes to any other issue regarding social services, this will be the same. Now, I want to conclude by saying that, well, empowered communities, we cannot achieve sustainable climate action without empowered communities who know what they want or who understand or have a high risk perception of climate change. Now, this I picked from the WHO, and then it's about the different levels of participation, which I believe Prof. Osborne has already spoken a lot about. And of course, it starts from inform, where they just go to inform the community, well, we have this, that, and you mobilize them. You do whatever you want to do after you have achieved your interest as a researcher or at a development organization. You are out and you leave them and they figure themselves out. This is a whole process. But I would, for the sake of time, I think that we need to begin to see how we can systematically, like Prof. Osborne said, empower communities. And when I say empower communities, what do we mean? We need to be able to work with communities to such a level that they can mobilize themselves, use their community assets, both cultural and social networks, and then to be able to determine what they want and lead change, and also hold people that are supposed to deliver the most important service to them accountable. So I think that in summary, I would say that we cannot do climate change without the community and other developmental agendas that we have. So the community remains central, and without the community, we can make all the agreements globally. It's not going to fly. Communities where people live and work, and they know their communities well. And they are the only people that can help us when it comes to this. Thank you very much.